Hi, my name is Hannah. I'm a student with St. Mary's. Today we're going to be teaching you how to wash your hands, especially for infection control during clinicals and anytime you're helping with patients. You want to make sure you're doing good hand hygiene. This is especially important if your hands are visibly soiled or if your patients have C. diff. Okay.
First step, we're going to inspect our hands for cuts and abrasions. We're going to ensure that our nails are no longer than a 1/4 inch long. Then we're going to push watch and uniform sleeves above wrist and also remove any rings. Next, we're going to stand in front of the sink, being careful not to let our uniform touch the sink. Next, we will turn on the water. You can modify the flow rate to your own choice and adjust temperature until the water is warm. Without splashing the uniform, wet your hands and wrists thoroughly, keeping hands and forearms below the elbows. Next, you will dispense 1 teaspoon of liquid soap into your hands. Rub hands together using firm circular motions for 15 to 20 seconds. Wash all surfaces of hands, including palms, backs of hands, fingers, and in between each finger. Ensure to wash 1 inch above the wrist. Next, you will clean under each fingernail of the opposite hand with your other fingers or a disposable nail pick. Next, we will rinse our hands and wrists, keeping your fingertips pointing down. Now, keeping the water on, raise your hands above your elbows. Use a paper towel to pat both hands dry from the fingertips to the wrists. Dispose of the paper towel. Using a clean, dry paper towel, turn off the water. Now, discard the paper towel.
Hi, this is our step-by-step of our hand sanitizer. This is a good habit to do when you go into a patient's room, out of a patient's room, and anytime you're touching any of their belongings or anything, just do a quick rub with your hand sanitizer. If they're visibly soiled, you got any body fluids or just questionable substances on your hands, or if the patient is on a C. diff precaution, you do not use alcohol-based sanitizer. You do our soap and water just to clean that off and be safe.
For antiseptic hand rub, inspect your hands for cuts and abrasions. Ensure nails are no longer than a 1/4 inch long. Push watch and uniform sleeves above wrist. Remove any rings. Using the manufacturer's recommendations, dispense proper amount of product into hands. Rub all surfaces of the hands together until dry. Include palms, back of hands, fingers, in between each finger, and even down your wrists.
The ATI accepted practice and indications for hand hygiene are to prevent transmission of microorganisms. Hand hygiene should be performed before and after patient contact and after bodily fluid exposure. Hand hygiene is the most important measure for infection control. ATI evidence-based practice is to use alcohol-based sanitizer unless hands are visibly soiled or the patient has C. difficile. You must wash your hands with soap and water if the patient has C. diff. The proper evidence-based practice is to wash hands for a minimum of 20 seconds when using soap and water. Some key considerations are to remove jewelry. Nails should be no longer than 1/4 inch past the nail bed. Avoid artificial nails. Use proper hand washing technique, all surfaces of the hands for at least 20 seconds, and to perform the 5 moments of hand hygiene before touching a patient, before a clean aseptic procedure, after bodily fluid exposure, after touching a patient, and after touching a patient's surroundings. The documentation tips for hand hygiene are very limited because hand hygiene is not typically documented. You may document if the patient has isolation or if any patient or family teaching was provided.